A number of features are really going to be helpful caring for patients. One is single rooms, all single rooms, which is an issue from a privacy point of view. When you're interviewing patients, there's some sensitive information you're talking about, which is challenging when there are two patients in the room. There's the size of the rooms. The old hospital was built 40, 50 years ago at a time when we didn't anticipate the amount of equipment and other items needed to care for patients. There's 3 zones. There's the patient zone in the middle. There's a family zone up against the window, which includes a couch that folds out into a bed for them to stay overnight as needed. And then there's the healthcare worker zone, which has everything they need to help care for their patient, including a computer for all their documentation that keeps them in the room more so they can interact with the patient. There's what we call a nurse server or pass-through, which is a storage system that is stocked from the outside, so you don't disrupt the patient when you're stocking, but more importantly, it contains over 80% of all the supplies needed to care for patients, so the nurse isn't having to stop what they're doing, walk down the hall to a central supply station.
There is a patient lift. As our population gets a little bit bigger, it's important that we save our staff's back, keep them from injury, and so it's on a track that goes forward, backwards, and across. And so you can easily move the patient up in bed, you can transfer them to a chair. So very convenient in every patient room. All these spaces were designed by staff, so the bathrooms are huge. Very easy to maneuver in and out of the shower, safety seat of course.
Simple things like not having a lip as you come out of the shower, so that there's less of a trip hazard. A lot of details like that for patient safety.